What is Nipah? A high-risk virus making a comeback in India. A deadly virus once thought to be under control has returned quietly, dangerously and without warning. In West Bengal, two nurses are fighting for their lives after testing positive for the Nipah virus, a pathogen known for its high fatality rates and sudden outbreaks. Nearly 2 decades after Nipah last surfaced in the state, its reappearance has set off alarm bells across India's public health system. Confirmed by the National Institute of Virology in Pune, the cases involves healthcare workers from a private hospital in Barasat, North 24 Paragonis. One nurse is currently in the coma, the other on ventilator support. With over 120 contacts traced and several people's quarantined, authorities are racing against time to prevent further spread. Why these outbreaks matters? This is West Bengal's first reported Nipah clusters in almost 19 years. The state last faced the virus in 2007, following an earlier and deadlier outbreaks in Siliguri in 2001 that claims dozens of lives, many of them healthcare workers. The current clusters raises urgent question: how did the virus return, and could it spread further? Health officials are investigating multiple possible sources, including contaminated data palm sap from Nadia districts and exposures to an elderly patients who may have been the index case. The situation mirrors past outbreaks where early symptoms went unnoticed, allowing the virus to move silently through close contact. Nipah in India, a troubling pattern. Nipah is not new in India. After the West Bengal's outbreaks of 2001 and 2007, the virus resurfaced with devastating impact in Kerala. Kerala 2018, over 17 deaths triggering nationwide concern. Kerala 2023 and 25, smaller but deadly outbreaks with fatality rates touching 70 to 75%. WHO data confirms multiple cases and deaths in Kerala alone in recent years. Beyond West Bengal and Kerala, states such as Tamil Nadu, Karnataka, Maharashtra and Assam have strengthened surveillance due to proximity, travel links and bad populations. Eastern India, particularly West Bengal and parts of Odisha, remains vulnerable because of dense human settlements overlapping with bad habitats. How Nipah spreads from forests to hospital wards. Nipah is a zoonotic virus carried by fruits bats of the Petropus species. These bats show no symptoms but shed the virus through saliva and urine. Humans become infected by consuming fruits contaminated by bats, drinking raw data, palm sap stained overnight, contact with infected pigs. Close contacts with infected human-to-human transmissions is especially dangerous in hospital settings. During the Siliguri outbreaks of 2001, nearly 75% of cases involved healthcare workers and unsettling echoes in today's West Bengal cases. Symptoms that deceives Nipah often begins like a common viral illness. Fever, headache, muscle pain, vomiting and sore throat appears after an incubation period of 4 to 14 days. But the disease can escalate rapidly into dizziness and confusion, acute encephalitis, seizures, coma or respiratory failures. Fatality rates range between 40% and 75% depending on how quickly care is accessed. Even survivors may face long-term neurological problems. No cure yet but hope on the horizon. There is currently no approved vaccine or antiviral treatment for Nipah. Patients receive supportive care in isolation, oxygen, fluids and management of complications. However, hope is emerging. In December 2025, vaccine entered phase 2. Trials after showing safety in earlier testing. Monoclonal antibody therapies are also expected to begin trials in 2026. Until these options become available, prevention remains the strongest weapon. What experts emphasize, public health experts stress that early detections can save lives. Kerala's recent successes shows that rapid isolations, aggressive contact tracing and community awareness works. The World Health Organizations continue to push a One Health approach, tracking the virus across animals, humans and the environment, especially in bad dense regions, spanning eastern and southern India. How to stay safe? Simple precautions can break the chain of the transmissions. Avoid raw data, palm sap, wash and peel fruit thoroughly. Discard fruits bitten by bats. Use mask, maintains hygiene around sick individuals. Healthcare workers must be used full protective equipment. reports fevers with neurological symptoms immediately, especially after travels to affected areas.